My inspiration for pursuing a career, a passion in maternal health really came from a lot of events that happened in my personal life. So around the age of 16, I lost a friend of mine to preventable complications from lupus that were exacerbated by her pregnancy. And now we know that people that deliver in underserved and under-resourced hospitals are more likely to experience maternal health inequities, complications. But losing a friend at the age of 16 was quite jarring and traumatic. And her daughter just graduated from law school, which is beautiful. But we should not be losing birthing people at any age in a place like the United States. When I came to New England, there really wasn't much happening on the maternal health landscape. I think for me, this place represents an opportunity for innovation. We're not getting in front of this crisis because we don't have the workforce we need. We need more doulas paid well. We need more midwives trained and going into communities. And through our education and training unit, I see us training midwives, I see us training doulas, I see us contributing to the workforce. We know that when providers look like their patients, we have better outcomes. We know that when there's culturally and racially congruent pairing, people do better. And so how do we infuse the public health and the clinical workforce with people that come from communities of color and making sure that they're able to thrive, live healthy lives, get paid a really nice wage for their skills? I see the center contributing in that way. Focusing on doulas, training of midwives, holding clinicians accountable more so than we have been doing around their biases and how that plays out in the delivery of care. Those are the three big things that I'd love to see us focusing on right now.
Because midwives save lives. Midwives save lives.
One of the biggest lessons is to keep good people around you. I could not do the work that I do. I'm getting emotional. Cut this out of the video, by the way. I did not need this in the video.
She is amazing. She's a powerhouse. She is very intentional in her work and in what she does and in the people that she comes across with.
Her belief in us really inspires us to want to do more to expand our strengths and skills.
Because she really is just, moving and shaking, and it's amazing.
And she lights up a room. She walks in, she's smiles, and it literally is like a light in a room, which is really, I think that's awesome.
March of Dimes' mission and my mission are one and the same. And now working with March of Dimes here in Massachusetts, really championing each other's work in birth equity, supporting initiatives that my center is doing. I think that's something I want people to know, is that March of Dimes is a national leader in clinical research and funding research sites. And I think that's exciting and amazing because that research is translatable to the families and communities that need it most. Not to mention March of Dimes has amazing people that are personally committed. I think that's what I look for when I think about where do I want to align with and who do I want to be connected to. That's one of the things that keeps me coming back to the table, is this March of Dimes personal commitment to prematurity awareness, to birth equity, to families. It's an amazing organization.